Yesterday, we reported about 1,011,871 cumulative cases and over 7,000 new cases. In this last epidemiological week, we have surpassed the peak of the first wave, and we had indicated that the epidemiological picture would compel us to tighten the restrictions. So those numbers are real. We've seen that they are increasing. The majority of the new cases now are coming from KwaZulu-Natal. In the yesterday's numbers, 30% were from KwaZulu-Natal, and then 29% from Western Cape. In Gauteng, it was 24%, and Eastern Cape was 51%. So the majority of the new cases are coming from those four provinces. Overall positivity for the newly tested individuals is 32.9, with Western Cape at 45%, followed by Limpopo at 41%, KwaZulu-Natal at 36%, and Mpumalanga at 33%. Those numbers are very high, and we during the lowest peak, lowest level, we're at around 10%. And so we just want to indicate that this increase in positivity rate is showing us that we have actually a fast-growing epidemic. The positivity rates are therefore a major concern, as we have said that we used to have 10% and less. That's when we were benchmarking to be stable in a plateau. 11,256 patients are currently in hospital, and that number has been increasing literally every day. This is 8.3% of our active cases. Now, of course, of these cases, 3,543 are on oxygen and 604 are on ventilators. According to the resurgence threshold, the majority of districts in South Africa are now in response phase. This means that they are greater than or equal to 20% increase in new COVID-19 cases compared to the 7 days before. So we check every 7 days, how high are you from that previous one. The safety of our healthcare workers remain our paramount concern. Right now, I was in a meeting where we're discussing with the trade unions on this issue because it's a matter of our major concern. And we're concerned by the rising number of professionals becoming infected with COVID-19 during the second wave. We continue to engage unions and praise them on this plan of our resurgence plan and our response to the health and safety issues. It will greatly assist, therefore, for us as we welcome in a few days 2,367 medical interns. Those are the new ones that are allocated. And then 1,693 medical community service practitioners who are part of a whole team of 7,895 community service workforce from all categories. These are the new employees we're bringing into the system to actually help to deal with this situation. Obviously, every year we have to provide posts for these particular categories. I think it's important to indicate that we have accommodated all that qualify to be accommodated. This will provide also a relief for a number of those who are exhausted. And we also are focusing on the availability of PPEs, which at this point in our day-to-day audit, we check availability is above 87%, which we want to move really up to 100%. Here we're working together with unions on creating what we call occupational health and safety committees. We want to encourage unions to access the dashboard and use the stock visibility system so that they can do the monitoring of the PPEs. At this point, we have actually given access to the government departmental PPE dashboard so that unions don't argue, don't raise an issue in abstract. They go into a hospital and check, and then they say, but here there's a shortage, and we're talking from the same system. This has helped quite a lot. This is important because the number of health workers who are infected has increased, and this will tend to happen each time the community transmission increases. The health worker also get a higher proportion of that because they are part of the community.